Close your eyes and imagine your world without your eyesight. You'd miss the beauty of a sunset, the simple pleasure of watching a baby take their first steps, the freedom of driving your own car. At Eye Care Associates, we understand how precious your eyesight really is. That's why we put the latest technology in the hands of the most experienced eye specialists. Whether you need pediatric care or the most advanced refractive or surgical procedures, you can trust the specialists at Eye Care Associates to do whatever they can to help you achieve your best personal vision. For more information, call us at 330-747-2733. With multiple locations in the Tri-County area and our convenient Saturday hours, it's easy to see. At Eye Care Associates, we're clearly focused on you.
Hello, and welcome to tonight's special program, Clearly Focused on You. In the next hour, the experts at Eye Care Associates will take us on a journey to discover the many aspects of eye care, including various conditions and treatments that may affect you. You may even discover some things you didn't know about your own eyes. We're going to take this time to cover a wide range of eye care topics: cataracts, glaucoma, pediatric eye problems, disease, and age-related issues, as well as corrective and cosmetic procedures. Joining us during the hour will be the specialist from Eye Care Associates, who will walk us through these topics and help explain why it should matter to you. They also have some exciting news to share with us later in the program about new developments in cataract procedures, and also a big announcement for 2014. Eye Care Associates have been in our valley for nearly 80 years, and their team of professionals want to take this time this evening to share with you some of their expert knowledge when it comes to the health of your eyes.
The Eye Care Associates Group has been a part of this valley for over 75 years. From humble beginnings in the old Dollar Bank building in downtown Youngstown, the practice has now grown to include locations throughout the Mahoning Valley. Eye Care Associates were the first in the area to have ophthalmologists and optometrists practicing side by side in the same facility. We provide primary eye care, general ophthalmology, and optometry, and have fellowship-trained ophthalmologists in glaucoma, retina, pediatrics, and oculoplastics. Eye Care Associates have provided area residents with many firsts when it comes to the treatment of their eyes. In 1961, our physicians performed the area's first corneal transplant. In the 70s, we introduced fluorescein angiography, laser technology, and on-site computerized imaging to aid in diagnosis and treatment of diseases. In the 80s, we began performing refractive procedures and led a national study of soft, foldable intraocular implant lenses. In the last 20 years, we introduced the area's first pediatric specialist, the area's first glaucoma specialist, the first oculoplastic specialist, and the first ophthalmic ambulatory surgery center. Today, the Center for Advanced Eye Surgery's state-of-the-art surgical center is fully equipped with the most specialized diagnostic and surgical equipment available, including the advanced technology of ophthalmic lasers. This allows Eye Care Associates to offer the most comprehensive and fully integrated ophthalmic surgical care in the Tri-County area. Our team of specialists work together to provide advanced treatments in almost every area of eye care, including cataract diagnosis and surgery, glaucoma care, pediatrics, macular degeneration, diabetic retinopathy, and the most experienced corrective and cosmetic surgery team in the area. Our patients tell us when they enter our doors that they receive the utmost care and attention in all areas of our practice.
Everybody was great. They explained the procedure very well.
The doctors, the staff, everybody was wonderful at Eye Care. They make you feel welcome, they're comfortable.
The staff is very professional. They're very, very careful with you. They make sure that you understand procedures.
At Eye Care Associates, our first priority is you. Our staff and specialists provide the best care available in our region, and our practice has the most advanced treatment options available anywhere. There is no need to ever leave the area for your eye care needs. Eye Care Associates, clearly focused on you.
Cloudy vision can be a normal part of aging, but it can also mean something more serious. And that's why the professionals at Eye Care Associates are here to speak to us about the subject of cataracts. We're joined by Dr. Lynn Yakuboff. Welcome to the program.
Thank you very much.
Doctor, can you explain to our viewers exactly what a cataract is?
A cataract is actually a clouding of the natural lens inside the eye. It's in a sac, basically, right behind the colored part of the eye, and it's layers, I would say layers like an onion, and those layers start to get cloudy and thicker as we grow older.
How do we detect this? What are the symptoms for the individual?
Usually it's blurring of vision, glare, nighttime glare, starburst around lights. That's probably one of the primary symptoms that will bring someone into the office to be evaluated. We see it under the microscope, of course, during a normal eye exam.
And do we know what causes cataracts?
Primarily, it's just as we get older, and we'll all get them if we live long enough. Other conditions can, however, cause cataracts to form earlier. Some medical conditions like diabetes, if you're a smoker, they will usually, a cataract will form earlier. Some problems, kidney problems, blood pressure problems, some other medical conditions can make a cataract grow faster.
So for you, what sort of tests are done to diagnose and detect the cataracts?
They're usually detected during a normal routine eye exam where we dilate the eye and take a look at every part of the eye, basically, because light has to focus coming into the eye from the cornea to the lens to the retina. So the vision itself, and then we check for glasses prescription to see if that can clear things up and see what the vision is that way. We can do some glare tests that kind of bring out or simulate almost glare at nighttime with driving headlights, street lights, things like that, to see if that makes the vision worse. That would correlate with a cataract. And looking in the slit lamp, which is our microscope, we would be able to see the lens itself and see the cloudiness.
So then once we have a diagnosis, what are the next steps for a patient to treat the condition?
The only way to remove a cataract or get rid of it is by surgery. There's certain criteria on how bad the cataract has to be and how bad the vision has to be, and their level of symptoms where it interferes with driving or seeing street signs or seeing the crawl on a TV. That also qualifies. There's criteria for having cataract surgery.
Dr. Yakuboff, thank you so much. Great information. I'm sure a lot of people learned a lot about cataracts.
Very good. I hope it was helpful. Thank you.
And we'll go back and kind of review what we've learned about cataracts. Cataracts are a normal part of aging. Symptoms include fuzzy vision, decreased color perception, and poor night vision. Cataract surgery is the only effective treatment for cataracts. So let's take a quick look at how the basic cataract procedure works.
Usually with cataract surgery, a small incision is made in the eye. The front portion of the thin outer covering of the lens is opened to allow removal of the cataract inside. The cataract is gently broken up and vacuumed out. Then a folded lens implant is inserted through the small incision and into the capsule, where it unfolds and permanently takes the place of the clouded natural lens. With the cataract removed, the new lens implant clearly focuses light rays onto the retina. The power of the lens implant is selected for your individual eye.
We're joined now by Dr. Keith Wilson and Dr. Haishu Wong, and they're here to discuss some really exciting advancements in cataract surgery. Welcome to you both.
Thank you.
Dr. Wilson, we just saw in the video how a lens is inserted into the eye in cataract surgery. But I understand that Eye Care Associates is now offering laser cataract surgery. Can you tell me how that's different from traditional cataract surgery?
Yes, cataract surgery is one of the most commonly performed surgeries in the country today. It's very safe and its outcomes are very predictable. We feel with the laser cataract surgery we're able to improve upon these already great outcomes. The laser uses computer imaging of the eye and then uses high energy femtosecond laser to perform procedures that are typically performed by the surgeon with a blade. These maneuvers are highly dependent on the surgeon's skill his volume, and his expertise. It really allows us to perform surgery, what we call bladeless cataract surgery. Cataract surgery, you have to make an incision in the eye to gain access to the cataract. And in traditional cataract surgery, that incision is made with a blade. But with the laser, it's made with laser technology so that the incision is more secure, it's more precise, it's watertight, and it doesn't require any sutures to close it.
Any other differences in this procedure than just the bladeless incision?
Yes, there are two additional important advantages that the laser provides us. The laser allows us to make a very precise, what we call capsulotomy, which is an opening in the capsule that surrounds the lens or the cataract. And we feel that this opening that the laser makes is more precise. And studies have shown it's 10 times more accurate than what can be performed manually by the surgeon. And we feel that this is an important difference that allows better centration of the intraocular lens and provides better outcomes for the patient. Another important difference is that the laser allows us to soften the hard core of the nucleus so that we don't need to use quite as much phacoemulsification energy or ultrasonic energy in order to remove the hard core of the lens. And this is advantageous because it provides less stress on the ligaments that hold the lens in place, allows less chance if there's rupture of the capsular membrane, and again, make sure that that lens is centered and provides a better outcome.
And doctor, what about astigmatism? Can the laser also be used to treat astigmatism?
Yes, it can, especially with the advanced technology intraocular lenses that provide good vision without glasses after cataract surgery. It's important that the cataract surgery result in a very minimal amount of astigmatism. Now, traditionally, the surgeon can treat astigmatism using a blade to make incisions in the cornea to reshape it. And that's called astigmatic keratotomy. However, with the laser actually is used to make very precise incisions, and the laser can control the exact location, the depth, and the length of these incisions. So they're very, very accurate.
So Dr. Wong, are there different types of lenses that the patient can choose from?
Yes, there are basically three types of intraocular lens implant. The first type called a monofocal implant, which is the patient after have the implant, they can see really good distance without glasses. For those people who are traditional, have to wear glasses for either nearsight and farsighted, this is a great procedure for them because it's almost like you had LASIK surgery. You can see distance now without glasses. Now the second type of the implant called toric implant. With toric implant, that the astigmatic correction are carved into the implant. So after this implant put in the patient's eye, the patient can see real good distance without glasses. But all those two kinds, you can see good distance, but you cannot see close up. Now there's a third type, which is called restore or crystal implant. Now this implant, not only that they can see far away, close up, and intermediate visions. So this is called lifestyle implant. So basically, there are three types of implant. The patient will have to go to their doctor, have their health examination. The doctor will recommend which is best implant suit for their eyes.
So does the new laser technology change the lens options for the patient?
Absolutely. As Dr. Wilson has mentioned earlier, that the laser cataract surgery is more precise. As good skill as eye surgeons are, we cannot draw two circles exactly the same, but laser can. So laser add a much more precise into the operation. So the result will be much more close to desirable effect. So that's number one. Number two, people with small astigmatism, now they can have this restore crystal implant with the system of laser to correct the astigmatism during the surgery.
So is there a difference in how you evaluate patients prior to surgery?
Yes, there are. Before the surgery, the patient will come to the doctor. Doctor would evaluate the eyes, like routine cataract surgeries. But in people who want to have this premier or lifestyle implant, we have to do additional testing called topographer. And also all the tests have to be very precise in order to have desirable results. Also during the surgery, that the machine will be able to measure the eye again in a different way to give more precise results. So they are different.
Right now, let's take a look at some of the types of lenses we've been discussing, and then hear how these advanced IOLs are making a difference in patients' lives.
Diane couldn't get over how much older I looked. No, the clarity was just unreal. I mean, it's really hard to imagine that there could be that much difference in an hour and a half.
So far, it's wonderful. Yeah. I see like I did when I was a young girl. I felt like I was depressed before. Next day I was a happy person, excited, and just weight was lifted.
It was wonderful. I could see immediately right after the surgery. And I would run around and close the eye that still had the cataract and look out of the good eye. I couldn't wait to get the second eye done after my first eye and the experience with it. It just completed everything. It was wonderful.
At this point, I'm sure some of our viewers may have additional questions regarding this and other eye care issues, and we are set up to have a specialist answer your questions directly, either by sending us a message on Facebook or through info@eyecareassociates.com. Now let's move on to another topic, glaucoma. It is a disease of the eye that forms gradually and without pain, and that's why it's important to detect early, because it can cause irreversible damage to your sight. We're joined now by Eye Care Associates glaucoma expert, Dr. John A. Thank you for being with us, Doctor. Can you explain for our viewers exactly what glaucoma is?
Yes, glaucoma is a disease of the eye which can lead to blindness. This disease affects the optic nerve and does damage to the optic nerve itself, which is the pathway and cable that takes the pictures from the eyeball to the back of the brain.
Now, we heard earlier that glaucoma can actually kind of creep up on you undetected, but in some cases, are there indicators?
Usually not in most forms of glaucoma. The visual damage that occurs is not easily detected early on. There are certain forms of glaucoma, angle closure glaucoma, which leads to quite a bit of pain acutely, and that is one form where it lets you know that it's there.
And what is the effect of glaucoma on the eye?
In its severe form, end stage, blindness. It takes away parts of the vision. Those pieces and parts can oftentimes add up to major loss in our visual field. Only in its end stages will it affect the acuity, and most people view their vision as their acuity. How clearly do I see?
Now, we've all had that little air puff in the eye, but what else can you do to diagnose glaucoma?
There's many things that we can do to diagnose glaucoma. The air puff is one way we use to check the pressure. There are applanation pressures that we use, Tonophen pressures that we use as well. Probably the best way of diagnosing glaucoma is actually looking at the optic nerve itself through a thorough examination. But we have visual fields which we use to follow progression, check patients to see if they've lost any visual field. Also, there's computerized programs and diagnostic tests that allow us to map out the optic nerve.
So then what are the treatment options if you have glaucoma?
The early stages of glaucoma we treat typically with eye drops. There are a multitude of eye drops. We're fairly lucky. We have a good range of eye drops these days which do a fairly good job. Most people are controlled on those eye drops. For people who get beyond those the eye drops, we have lasers we can use. Selective laser trabeculoplasty is a good 2-3 minute procedure which can help to lower the pressure. It works about as well as adding one eye drop. Later on, end stage forms, more severe forms, we can actually do surgery to create a new drainage channel for the fluid to make its way out of the eye.
And I understand that you're now using a relatively new advancement in treatment. Can you tell us a little bit more about the iStent treatment?
The iStent's a new procedure which was just FDA approved, and for me it's an exciting new tool that I can use for patients at the time of cataract surgery. It doesn't add very much time to the procedure. Patients don't perceive any decrease in vision with this procedure as they do some of our other procedures. And it's minimally invasive. This is the smallest implanted medical material that we use in the world today.
Okay, well, let's see exactly how this works.
The FDA-approved iStent implant is the world's smallest medical device and can be surgically placed into your eye. The iStent device is designed to lower intraocular pressure, and some patients may experience a reduction in their glaucoma medications, but this will be at the discretion of the physician managing your glaucoma. The iStent implant works by improving the eye's natural ability to direct fluid flow through the trabecular meshwork, which is the anatomy through which fluid exits the eye. Most of the fluid in your eye naturally drains through this meshwork and into the bloodstream through a structure called Schlemm's canal. When this outflow system becomes blocked, the pressure in your eye increases. The iStent implant is designed to bypass the blockage within the trabecular meshwork and improve the natural flow of fluid out of the eye. The iStent procedure is minimally invasive and is performed at the same time as the cataract surgery. By lowering eye pressure, the iStent implant may reduce your need for glaucoma medications.
I discovered that I had glaucoma by going regularly to my eye doctor and being treated. They knew that the pressures were up and the drops were keeping things under control, but then all of a sudden it just the drops were no longer working for me and I was starting to lose my peripheral vision. They tried several different brands of medication, new medications that were newly out on the market, but things just were not controlling it, no matter how often I put the drops in or the brands that I was using. When I first came to see Dr. A, he did in the office a very full exam. Pressures were up into 30s, and more normal pressures would be down around 15. So he had to kind of pull out the big gun. I look at it as a last resort in my left eye to have the surgery done in the left eye, and kept watch then of my right eye. No, it doesn't feel any different because you don't even realize with your pressures being up that that glaucoma kind of just steals and robs your vision because you can't feel it, you can't tell it, there's no pain or anything there. Oh, it was very easy. Actually, I came here to the Western Reserve offices, and it's really amazing to have the stent put in itself with the minimal invasiveness. You go right back to work, no side effects. And one of the great things of it is that this is newly FDA approved, and we don't even have to leave our community to have this done.
So before we go, can you give advice to someone who finds they have glaucoma?
My best advice for people who have glaucoma is to continue with their doctor, thorough examinations, thorough follow-ups, use their medications. It's one of the problems that we have with many patients today is that compliance tends to be an issue. Do they use their eye drops on a regular basis? My recommendation is really just to follow with your doctor, do what he asks, and continue doing that. Glaucoma is a disease you will live with for the rest of your life. It's not curable, it's treatable.
Now let's review what we've learned. Glaucoma develops gradually and causes no pain. Thorough eye exams are the only effective way to diagnose glaucoma. Glaucoma can be treated, not cured. Damage caused by glaucoma cannot be reversed. When we come back, we're going to be discussing pediatric eye care with one of the area's foremost experts, Dr. Sergo Ezram.
At Eye Care Associates, we understand how precious your eyesight really is. That's why we put the latest technology in the hands of the most experienced eye specialists. Whether you need pediatric care or the most advanced refractive or surgical procedures, the specialists at Eye Care Associates are here to help you achieve your best personal vision. With locations throughout the Valley, we are easy to find. Call us at 330-747-2733 to schedule your visit.
Welcome back. If you're a parent of a young child, this next segment may be of interest to you. Many children can experience different eye problems, and the protocols in treatment can be quite different from those for adults. They require the care of a specialist trained in pediatric eye issues. Eye Care Associates and our community are truly fortunate that Dr. Sergo Ezram is trained specifically as a fellow in pediatric ophthalmology, and she will be joining us to share some of her insights in treating children.
My doctor's name is Dr. Ezram. When Hadassah was about 20 months old, she was diagnosed with juvenile rheumatoid arthritis, and the inflammation can be in the eyes also. So it's sort of silent in that you don't know the inflammation is there. As far as symptoms, like I wouldn't notice symptoms. Only a trained doctor would know. how her eyes are, if there's inflammation there. Her eyes were fine at the time that we came in, so she just watched them periodically and diligently to make sure they were okay. And she did end up having inflammation in her eyes. She got medicine in her eyes, and after probably about 6 months' time, the inflammation was gone.
My Dr. Ujum made my eyes all better.
Thank you so much for joining us, Dr. Isram. First of all, let's talk about strabismus. Do we know why a child's eye may turn in or out?
Well, strabismus is a generic term that's kind of a wastebasket for a lot of different conditions. And it basically means that the child's eyes are not aligned. And that could mean that one's child's eye is inward, outward. It may alternate throughout the day. It may not constantly be in one position. The etiology of strabismus is actually quite complex. Some children are actually born with specific disabilities or problems that may set them up for an ocular misalignment. But the majority of kids that we see seem to have a difficulty with focusing. And that's what leads to their problem with the misalignment.
Can you tell us about the test for strabismus and amblyopia?
Well, amblyopia is a separate condition which often goes hands in hand with strabismus. When you're looking at a child with strabismus, the majority of the time you're assessing them by how well their eyes are straight. And that's done in an ophthalmologist's office or an optometrist's office, looking at ocular alignment and depth perception. And it's relatively easy to diagnose because the parents often will come in telling you their child's eyes aren't straight. Amblyopia is a little bit more tricky because a child doesn't have to have an ocular misalignment. It's actually decreased vision for no apparent reason.
Now, as I understand it too, in Ohio, there are required screenings in schools to determine if a child has this.
Yes, thankfully there is, because 96% of amblyopia is correctable. And to let it go without being treated and to cause permanent loss of vision in a child would be just horrible. Thankfully, a lot of our pediatricians have their own self-screening tests as well, and they are assessing children at the ages of 18 months to 2 years in their office. If a child isn't being screened by the pediatrician, it's getting caught at the preschool or the kindergarten level.
So, doctor, after a diagnosis, what are the treatment options?
Well, once a child is suspected of having amblyopia, it's very important that the parents bring the child in to see an eye professional who's comfortable with examining children. They need to have their vision checked. They need to have a depth perception assessment. They need a very good internal exam of the eye with a dilated exam. Typically, you're dealing with a problem with the child's ability to see out of the eye, the most common being a prescription error, needing a pair of glasses.
Now, doctor, I remember many, many years ago when I was in school, there was a child that came to school with an eye patch. Is that a treatment that's still used?
Absolutely. As soon as you examine a child with amblyopia and you determine whether they need glasses or don't need glasses, oftentimes patching fits into the therapy. Thankfully, nowadays we don't do the number of hours we used to do before, where a child would have to go to school or spend most of their day with their eye patched. Nowadays we can actually patch closer to only about 2 hours a day and still receive successful outcome.
Well, Dr. Isram, thank you so much for being here. This is really, really very informative, especially for parents. And I understand that you're going to be back with us later in the show to talk about corrective laser surgery.
Yes.
But for now, let's review again the information that we've learned about strabismus and amblyopia. Your child will not outgrow crossed or wandering eyes. Without proper treatment, strabismus can lead to permanent loss of vision. And it's never too early for a child to have an eye exam. When Clearly Focused on You continues, we will be discussing how diabetes plays a role in the health of your eye. The specialist from Eye Care Associates will join me to discuss diabetic retinopathy and the special procedures they have in place that can diagnose this. Stay with us.
Close your eyes and imagine your world without your eyesight. You'd miss the beauty of a sunset, the simple pleasure of watching a baby take their first steps, the freedom of driving your own car. At Eye Care Associates, we understand how precious your eyesight really is. That's why we put the latest technology in the hands of the most experienced eye specialists. Whether you need pediatric care or the most advanced refractive or surgical procedures, you can trust the specialists at Eye Care Associates to do whatever they can to help you achieve your best personal vision. For more information, call us at 330-747-2733. With multiple locations in the Tri-County area and our convenient Saturday hours, it's easy to see. At Eye Care Associates, we're clearly focused on you.
If you're just joining us, we're at the halfway point in our program, Clearly Focused on You, brought to you by our friends at Eye Care Associates. In the last half hour, we covered a variety of topics that can affect a wide range of people. We've learned that there are exciting new advancements for people dealing with cataracts and glaucoma, and that Eye Care Associates is the only facility in the area that has this new technology. We've also explored the area of pediatric care with Dr. Isram, one of the foremost experts in treating our youngest patients. But before we move on, let's again cover the basics of eye care and learn more about our friends at Eye Care Associates.
The Eye Care Associates Group has been a part of this valley for over 75 years. From humble beginnings in the old Dollar Bank building in downtown Youngstown, the practice has now grown to include locations throughout the Mahoning Valley. Eye Care Associates were the first in the area to have ophthalmologists and optometrists practicing side by side in the same facility. We provide primary eye care, general ophthalmology, and optometry, and have fellowship-trained ophthalmologists in glaucoma, retina, pediatrics, and oculoplastics. Eye Care Associates have provided area residents with many firsts when it comes to the treatment of their eyes. In 1961, our physicians performed the area's first corneal transplant. In the 70s, we introduced fluorescein angiography, laser technology, and on-site computerized imaging to aid in diagnosis and treatment of diseases. In the 80s, we began performing refractive procedures and led a national study of soft, foldable intraocular implant lenses. In the last 20 years, we introduced the area's first pediatric specialist, the area's first glaucoma specialist, the first oculoplastic specialist, and the first ophthalmic ambulatory surgery center. Today, the Center for Advanced Eye Surgery's state-of-the-art surgical center is fully equipped with the most specialized diagnostic and surgical equipment available, including the advanced technology of ophthalmic lasers. This allows Eye Care Associates to offer the most comprehensive and fully integrated ophthalmic surgical care in the Tri-County area. Our team of specialists work together to provide advanced treatments in almost every area of eye care, including cataract diagnosis and surgery, glaucoma care, pediatrics, macular degeneration, diabetic retinopathy, and the most experienced corrective and cosmetic surgery team in the area. Our patients tell us when they enter our doors that they receive the utmost care and attention in all areas of our practice.
Everybody was great. They explained the procedure very well.
The doctors, the staff, everybody was wonderful at Eye Care. They make you feel welcome, they're comfortable.
The staff is very professional. They're very, very careful with you. They make sure that you understand procedures.
At Eye Care Associates, our first priority is you. Our staff and specialists provide the best care available in our region, and our practice has the most advanced treatment options available anywhere. There is no need to ever leave the area for your eye care needs. Eye Care Associates, clearly focused on you.
Next up, we will be exploring the retina. It's the part of the eye that takes pictures and sends the image to your brain. A condition that can adversely affect the retina is diabetic retinopathy, found in diabetics. It can lead to poor vision and even blindness. But first, let's take a look at this condition in more detail.
With non-proliferative diabetic retinopathy, or NPDR, damaged blood vessels in the retina begin to leak fluids, including small amounts of blood, into the retina. Sometimes deposits of fats may leak inside the retina.
We're joined now by Dr. Richard Wyszynski. Dr. Wyszynski comes to us from the Cleveland Clinic, where he is chairman of the Lakeland Eye Surgeons and Consultants and vice chair of the Cleveland Clinic Lorain County Institute. He's also a valuable specialist with Eye Care Associates. Doctor, thank you for joining us.
Thank you.
So I guess when we're talking about diabetic retinopathy, what are the symptoms?
Well, often there are no symptoms with diabetic retinopathy. We see patients often that come in who have had diabetes for a number of years, have no visual complaints. The measured vision may be normal. We look in and we'll see significant disease. Other patients may come with complaints of blurred vision. Sometimes it's been of short duration, sometimes it's been of longer duration. Patients can have floaters in their eyes that represent blood, sometimes total loss of vision either because of bleeding in their eye or what we call tractional retinal detachments.
What about a person's blood sugar level? How does that play into it?
Well, blood sugar levels are key to understanding diabetic eye damage and damage in the body generally. These elevated levels of blood sugar change flow through capillaries, which are the smallest blood vessels in the body. They can damage the eye as they can the kidney and other organs. And so managing blood sugar is a key element of minimizing risk for patients to have blindness or eye problems related to diabetes, and also kidney problems and other disorders.
Now, how do you diagnose the condition here at Eye Care Associates?
Well, the condition is diagnosed primarily through a thorough eye examination, which includes what we call a dilated fundus examination. The patient receives drops that dilate their pupils so that we have a direct view into the eye, and we can actually see whether or not there's damage, and if damage, what the severity of the damage is. We complement the examination of the eye by certain specialized tests that can lead us to greater information and also help us plan for the patient's care.
Now, the information that I saw, there's actually 3 ways to treat this?
There's a number of ways depending on the type of problem the patient has. Patients basically fall into what we call diabetic macular edema, which is a form of non-proliferative diabetic retinopathy, or patients can develop abnormal blood vessels on the surface of the retina. We call that proliferative diabetic retinopathy. Those two entities overlap but are generally treated differently. For example, patients who have diabetic macular edema or swelling of the retina related to diabetes could be treated with laser treatment. We have certain medications that we can inject into the eye to manage the swelling. Patients who have abnormal blood vessels on the surface of the retina may be treated with medications injected in the eye. They also are treated with laser, but many of those patients require surgery in order to reverse the complications and stabilize the disease.
Now, what can a diabetic patient do to prevent this?
Well, they can't necessarily prevent it, but they can do some things to minimize their risk. The first is to be screened for diabetes. There are many patients who are diabetic who don't know they're diabetic. This is see your primary care doctor, obtain fasting blood glucose levels. If there's some suspicion of diabetes, the doctor can do additional testing. The second is if the patient knows they're diabetic, then the key element is managing their blood sugar level, because the more regulated the blood sugar is, the less likely in time they are to have complications of diabetes. This is working with their medical doctor, they're taking their medications, often working with the dietitian, in addition to being seen routinely for eye examinations to screen for significant disease.
So basically, for diabetic patients, it's a matter of being compliant in order to minimize the risk of developing these conditions. Are you seeing this in early onset diabetes?
Most patients who have significant eye disease have been diabetic for a number of years. The problem is patients often are diabetic for many years prior to the diagnosis. So someone may come to me and say, I've been diabetic for 2 years. We examine the eye and they clearly have a disease level that's not consistent with 2 years of disease. Rather, what they're telling me is that they've been diagnosed for 2 years. They may have had the disease for 10 years.
Okay. Doctor, thank you so much. So let's recap. High blood sugar causes diabetic retinopathy. Symptoms include blurry or lost vision. Yearly routine eye exams are recommended for all diabetics. We just want to remind you that if you have additional questions regarding any of the eye care issues we are discussing, we are set up to have a specialist answer your questions directly by messaging us on Facebook or at info@eyecareassociates.com. We're joined now by Dr. Ryan Deasy. Dr. Deasy works and mentors residents of the ophthalmology department at the Cleveland Clinic and is a specialist in macular degeneration. Doctor, thanks for joining us.
Oh, it's my pleasure. Thank you for
Now, I
having me.
understand there's two basic stages to this disease. Can you tell us about that?
Sure. There is dry age-related macular degeneration and wet age-related macular degeneration. The dry form is the common form. It's what most people have. Unfortunately, for most folks, it does not significantly impact their vision. But all folks who have dry are at risk for getting wet macular degeneration. Wet macular degeneration, unfortunately, is where we see more significant vision loss, and that's the condition we want our patients to be most aware of.
Now, how do you diagnose this in a patient?
Part of a routine dilated eye examination, you look for hallmark features of the condition, which can include yellow bumps in the back of the eye called drusen, as well as pigment clumps, which can reflect the condition, the dry component of the condition. And we can also do imaging, fluorescein angiography, as well as a technique called OCT, optical coherence tomography, which can look at very close anatomic details of the back of the eye and give us clues that that condition may be active.
Now, I know there's been technological advancements. Can this be cured, or what other options are available to the patient?
Unfortunately, at the present time, there's no cure, but there is treatment that can enormously benefit patients. Over the past 10 years or so, a new class of drugs has come out that has improved outcomes for folks who have wet macular degeneration enormously. And if patients are identified promptly and treated, they can do very, very well.
Now, you mentioned that it can lead to vision loss or decreased vision. Can it lead to blindness?
It can cause legal blindness. So age-related macular degeneration affects the macula, which is the center of one's vision, and it can cause central blindness, which can have a huge impact on an individual's quality of life. Although they'll never go totally blind, they would never lose their ability to navigate a room or maintain peripheral vision. It's frustrating because they can lose their central vision, which can keep them from doing things like reading, seeing expressions on faces, seeing a clock, and driving. And so these are big deals that we want to try and prevent when we can.
Now, when people are coming in for their yearly or every 2-year eye exams, at what point do you start testing or screening for macular degeneration, or is it always a part of the routine exam?
Well, as the condition would imply, it is age-related. So as an individual gets in their 50s and beyond, and particularly if they have a family history for the condition, it's important to look for these features on their examination. We're very lucky that we have great natural history studies that have been done and give us good insights into who may be at higher risk for progression onto wet macular degeneration, and we may choose to follow those patients more closely. Additionally, we may counsel them differently and ask that they take preventative measures when appropriate. Stopping smoking would certainly be one if they're a smoker. And then also considering taking eye vitamins, a specific formulation of eye vitamins that's been proven in several large, well-controlled clinical trials to reduce the likelihood of advanced macular degeneration.
Now, we talk a lot about our valley graying. We have a lot of boomers around here. Are we seeing more of this condition locally?
I would expect so. I think around the country and around the world, we're seeing more and more folks living longer, and so we are seeing a lot of age-related macular degeneration. Certainly, I feel very busy treating the condition.
Okay. Great information. Dr. Deasy, thank you for being here.
My pleasure. Thank you.
So now let's take a look again at what we've learned. Macular degeneration cannot be cured. Early detection and stopping smoking are keys to lowering your risk of vision loss. Macular degeneration does not lead to blindness. When we come back, we are going to be discussing the area of oculoplastics. Now, this is simply not a fancy term for plastic surgery. Our specialist from Eye Care Associates will explain when we come back. Stay with us.
Close your eyes and imagine your world without your eyesight. You'd miss the beauty of a sunset, the simple pleasure of watching a baby take their first steps, the freedom of driving your own car. At Eye Care Associates, we understand how precious your eyesight really is. That's why we put the latest technology in the hands of the most experienced eye specialists. Whether you need pediatric care or the most advanced refractive or surgical procedures, you can trust the specialists at Eye Care Associates to do whatever they can to help you achieve your best personal vision. For more information, call us at 330-747-2733. With multiple locations in the Tri-County area and our convenient Saturday hours, it's easy to see. At Eye Care Associates, we're clearly focused on you.
There are many conditions that affect the eyelids, some congenital, some develop as the result of another medical condition, while some occur as part of the normal aging process. Regardless of the reason behind the changes, they can be corrected and improved with surgery. Eye Care Associates is fortunate to have Dr. Augustine Kellis as the Director of Oculoplastic and Reconstructive Surgery, and he joins us now. Welcome, Doctor. So the topic is blepharoplasty, or more commonly known as eyelid surgery. What is it exactly?
Well, there are several conditions that affect the aging eyelid. One condition is the extra skin of the eyelid just continues to evolve and form, and it can hang over the edge of the eyelashes, push the eyelashes into the eye, and actually affect the vision. Now, this can happen in conjunction with actually the eyelid itself drooping. And what blepharoplasty is the removal of the extra skin and the extra fat and reforming the eyelid crease. Sometimes when we do this, we elevate the brows at the same time. I've developed a technique from the inside of the eyelid where I can do that. Other times we move the muscle of the eyelid in addition to lift the eyelid a little bit up. In thyroid patients, for example, we can actually do things to put the eyelid down. But blepharoplasty itself is the removal of the extra skin, the removal of the fat. It comes from two Greek words, blepharo, which means eyelid, and plasty, which means to mold or to form.
Now, you mentioned a couple of examples, but why would someone want, or more precisely need, to have this procedure?
A lot of times patients are very much bothered by the extra eyelid skin. It's a weighted feeling. They need to lift their eyelids with their fingers in order to read. They feel like they don't see well when they're driving their cars. The oncoming headlights bother them. The side vision isn't as good. And what we do, we basically test this ahead of time, and sometimes the insurance companies, if this shows a big enough difference between the eyelids in their normal position and then their elevated position, will pay for the surgery. But basically the point of the surgery is to alleviate all those weighted feelings, alleviate possibly the headaches that the patient is getting. And the last thing, of course, is to improve the superior vision. Sometimes they can gain 30 to 40 degrees of vision from this type of surgery.
Now, one of the first things patients ask is there a risk to this surgery? What is it that someone should know before making the decision to go forward?
Well, I think first of all, as an oculoplastic surgeon, you're first of all a board-certified ophthalmologist. There are a multitude of conditions of the eye that preclude somebody having this type of surgery, and those are all evaluated in the preoperative evaluation. The other thing that we need to consider is, can somebody get off their blood thinners? We work with family doctors, we work with cardiologists, whatever the case may be, to make sure that the patient doesn't have any adverse effect. I would say the biggest two complications that one can have would be, number one, bleeding, which we are very careful with blood thinners. This very rarely happens. And infection is extremely rare on the face because the face has such a good blood supply. I probably haven't seen an infection in over 14, 15 years.
Doctor, you mentioned that you pioneered a technique. Can you elaborate on that?
I was probably the first doctor in Ohio and one of the first doctors in the country to use a CO2 laser to perform this surgery. I've performed probably 60 to 70,000 eyelid procedures with this particular laser. What the CO2 laser does is it's an incredible tool that minimizes the bruising and the swelling that the patients get. Patients don't want to be bruised and swollen for 6-8 weeks after surgery. And with a scalpel, which is how we all learned initially, that's not uncommon. With a CO2 laser, I typically take out sutures in 1 week, and it's just amazing. A lot of patients have no bruising or swelling at all. And what this does is it actually seals blood vessels as you're going along. It seals lymphatics as you're going along, and the lymphatics actually are what causes the edema or the swelling of the eyelid. Because we can seal all that and I can remove my fat pads with the laser, there's much less chance of hemorrhage afterwards, and there's much less chance of infection, I believe, and there's a more accurate placement of the eyelid because the eyelid isn't swelling like crazy when I'm operating on it. And it also speeds the surgery tremendously for me. There are times where I can get done in 6 to 8 minutes with one side of a blepharoplasty, whereas with a conventional scalpel, that's almost unheard of.
Okay, great information. Thank you, Doctor.
You're welcome.
Now, we spoke with a patient who had this procedure. Let's see and hear how it worked for her, and we'll also see some amazing before and after photos of other patients who've had this surgery.
Well, prior to the surgery, I was noticing for a number of years that I was having a very difficult time reading, especially for long periods of time, because my eyes would get very tired and my right eye particularly would just start to close and I couldn't read for any extended period of time. I'm a reader, so it was very frustrating, and then by the evening both of my eyes were just so tired that I couldn't enjoy reading any longer. And I began searching for an ocular plastic surgeon. That's exactly what I wanted, someone who specialized in the eyes and who worked on lids, and I didn't want anything to look cosmetic. At the time, I didn't want to appear startled, but I did want something that would at least relieve me of the heaviness in my eyelids and give me a new lease on life. After the surgery, it was interesting because very few people actually said, "Oh, what did you have done?" or "Did you have plastic surgery?" which is exactly what I wanted. Oh, it's wonderful. I can read anytime I want. I don't have to wait or not read at night. I can read all night long if I wish.
And now on to the final segment of our program. The professionals at Eye Care Associates have been the leaders in our valley when dealing with corrective eye care. In fact, they introduced the first laser here in 1978. This technology is changing almost daily, and the eye care surgeons are still setting the standard of care in their laser center. Before we speak to our doctor, let's hear firsthand from a patient who has gone through the procedure.
I've had glasses since I was in first grade. I needed my glasses for everything. From getting out of bed to looking across the room at the time on the alarm clock, to work, to driving. I couldn't take my glasses off. If I didn't have them, I could not see. If you were in front of me, you would be all blurry without my glasses on. So I decided that my mom had it done years ago, and I thought, I'd like to try it. I was reluctant at first, but I'm glad I did it. How I see now, oh my. The first time I could see perfect, I got off the bed and I could see the clock across the room in the surgery room. And I'm like, oh my gosh, I can see what time it is without my glasses on. My vision just kept improving every day. Now driving down the road, further to distance, I can see the signs, I can read them, even better than when I had my glasses on. So everything, it's the best thing I've done. I absolutely love it.
We're joined again by Dr. Erzurum, who will take us through the basics of laser eye surgery. First of all, can you tell us the difference between a nearsighted eye and a farsighted eye?
Yeah, I guess that's a pretty basic question, but a lot of patients are confused about which prescription they have. A nearsighted eye means that you can see things easier up close than you can in the distance. To us as ophthalmologists, it means that your eye is actually larger than the average eye, or your cornea is too steep or steeper than the average eye. A farsighted eye is just the opposite. It's someone who has difficulty seeing more up close than they do in the distance, and their eye is slightly shorter or their corneas are a little flatter.
And another word we hear, what about astigmatism?
Astigmatism often accompanies nearsightedness or farsightedness, and it is an irregularity in the shape of the cornea that causes us to see shadows around letters or images. And it requires an additional correction in your glasses or laser treatment in order to correct.
So now that we know the differences, which type of eye represents the best candidate for laser eye surgery?
You know, at this point, just about any eye is a good candidate. The laser actually treats farsightedness very well, as it does nearsightedness, and it has a fairly high range on the correction for astigmatism.
And at what age does someone become a candidate for this surgery?
Typically, we don't suggest laser refractive surgery for someone until they're about the age of 21, and you want to have at least 2 years of stability. If you've already started to develop cataracts, we would discourage you from thinking about doing laser surgery as well.
And I understand there's different types of laser vision correction.
There is.
Can you give us a rundown of those?
You know, all of them are done with the same laser. They're all done with an excimer laser. But there are different ways of getting the laser treatment to the cornea. There is LASIK, which actually creates a thin layer in the cornea, and by elevating that layer, we then do the laser treatment and replace that top flap on the cornea. The alternate procedure is what we call epi-LASIK, where we actually perform the procedure right on the surface of the cornea, and there's no incisions made in the eye, and both are very successful at changing the curvature of the cornea.
Well, let's take a look at that procedure now.
First, a corneal flap is created and folded to the side. LASIK involves removing corneal tissue under the LASIK flap to correct the focusing power of the cornea. How much corneal tissue is removed and the length of the laser treatment depends on the amount of correction needed. Treatment times can range from only seconds to a minute or so. The flap is then returned to its original position where it bonds without the need for sutures. Epi-LASIK is different from other forms of advanced surface treatment in that it actually uses a special instrument called an epikeratome to make the hinged epithelial flap. Next, the precise amount of corneal tissue is removed to correct the focusing power of the cornea. How much corneal tissue is removed and the length of the laser treatment depends on the amount of correction needed. Treatment times can range from only seconds to a minute or so. After treatment, if the epithelium flap was not completely removed, it is placed back over the treated area and will ultimately be replaced as new epithelium regenerates.
We've almost come to the end of our program, but before we leave you today, Eye Care Associates has an exciting announcement.
Eye Care Associates will be opening a brand new 6,000 square foot location in Warren. The facility, set to open in August of this year, will provide area residents with comprehensive care in all areas of ophthalmology and optometry, including state-of-the-art testing equipment for glaucoma, cataracts, pediatrics, and retina. Patients can also take advantage of a full-service eyewear gallery, all within the same building. So look for the new Eye Care Associates location at 4060 North River Road in Warren, opening later this year.
We'd like to thank you again for joining us in this very informative hour. And remember that Eye Care Associates is available to answer any of your questions by email or on Facebook. We hope you've learned a little something that maybe you didn't know before about eye care. On behalf of our friends at Eye Care Associates, good night.